Assalamu alaikum dear students, I hope you all are fine and in the best conditions of your health. So in today's lecture we will discuss about the preclinical trials for the course of medical chemistry, right? So far we have discussed about drugs. What are drugs? That anything that can affect your body in positive or negative ways called a drug. Then we studied about how drug can show its effect on the biological system, right? So we studied that it's important for the drug to be absorbed, to be partitioned, and to be able to bind with the receptors. Until your drug binds with certain target molecule, it cannot show its effect, right? So we have studied all of these contexts. Now we're coming to the point where we have set everything right, so the drug is in correct conformation to bind with the right receptor. So now we want this drug to be applied or administered on humans, right? We want to market that drug. So before a drug is administered or tested on humans, it has to pass through certain studies. So these studies which are carried out before a drug can be actually tested on human subjects, these studies are called preclinical trials. So we'll consider these in bit detail, right? Preclinical trials, also known as the non-clinical trials, are laboratory tests of a new drug, substance, or medical device. So normally these tests are carried out on animals to see whether the treatment or the medicine really works or not. And further, the preclinical trials are also concerned with the study that whether the medicine or the drug that you are going to test on humans, whether it is safe to test on humans or not. Because if a drug is toxic for animals, that will also be toxic for humans. So that's why before testing on humans, we firstly test on animal subjects, right? So the purpose of preclinical trial is number one, to see whether the treatment works or not, and secondly, it's also concerned with checking the safety of the drug, whether that should be continued to test on humans or not, right? So the main goal of the preclinical trial, the main purpose of the preclinical trial is to determine whether the product is safe or not, and whether products have a safety profile or not. If a product is not safe, it will be rejected, right? The experimental animals that are used for testing the drug, they are normally rodents. The first tests are performed on rodents, which include mice, rat, guinea pig, hamster, rabbit, etc. Right? These animals are selected because they have systems which closely resemble humans. So the diseases in human are just like the same in those rodents. So that's why those rodents are selected as test animals in the initial studies. So after we get successful results on rodents, we test these drugs on larger animals like cat, dog, and a monkey. So if these drugs also give successful results, then we can pursue the studies on human, right? So at any step, if we get some negative or unfavorable results, the drug gets rejected, right? So first step will be that we perform tests on rodents like mice, rats, etc. And then after successful studies, we will test our drug on larger animals like cat, dog, and monkey. And as the get those on humans, right? So as the evaluation process progresses, and at any step, if we get some unfavorable results or negative results, then the drug is rejected. So you can just imagine that among thousands of drugs which enter preclinical trial, only few are left which can be tested on human, because many of the drugs have some negative or unfavorable results on animals, so they are not continued to be tested on humans. So just have a brief overview of drug development process. Suppose that we have 10,000 of compounds that we have discovered, and among these tens of thousands of compounds, only 250 can enter into preclinical trial, right? So those which enter preclinical trial and those which get successful results, so we file an application which is known as investigational new drug, right? So those compounds which get successful results in preclinical trial, they are filed as investigational new drugs, and these enter then clinical trial. which has phases of its own, right? So these enter clinical trials, and among these drugs which are entering clinical trials, only few compounds, for example 5 compounds, enter into the clinical trial, and of these 5 compounds, only one compound is approved by the FDA, right? The NDA stands for New Drug Application. So if an investigational new drug passes through all clinical trials, then it is given the status of New Drug Application. The New Drug Application is still under surveillance. It's still studied for any adverse effect once it's marketed. So even after 2 years or 4 years of being marketed in the drug, it's still evaluated, that at any point if the drug is showing some adverse effect, it is withdrawn from the market altogether. You can just see that how lengthy is the drug development process. So the discovery of the active drug or discovery of your hit or lead takes about 2 to 5 years, right? In this process, in this duration of 2 to 5 years, we identify candidates which meet the profile of the target site, which can bind with a receptor. So after discovery of these active drugs, what happens that we take these drugs into preclinical testing. So preclinical testing takes about 1 to 2 years, right? So in preclinical testing, we check whether the drug is safe or not, whether it's efficacious or not, means that whether it is showing the desired properties or not. And after preclinical trials, the drug then enters clinical trials, which take about 6 to 10 years. And this study of clinical trial actually demonstrates the safety and efficacy of drugs in human subjects. For example, if you're considering the disease as tuberculosis, so the human subjects will be tested for the anti-tuberculosis drug, and we will see whether the drug is actually working on humans or not. So this is the drug development process. Now coming back to the preclinical trials. The preclinical trials actually involve several steps. The first step is to identification of the drug target, that we must know what is the receptor. Second step is we have to develop a bioassay. The bioassay is a mechanism, or it's a series of tests which will check for the biological activity of a certain disease, of a certain drug against a certain disease. So once you develop a bioassay, once you develop a test, then you screen the drug for the assay, and you check whether the drug has that biological activity or not. In the fourth step, we check the effectiveness and toxicity of the drug. And in the fifth step, the drug candidates which have a sufficient profile with efficient effect and low toxic effect, these are then filed as investigational new drug or IND. So these are the basic 5 steps that are involved in preclinical trials. Right, so it's objective is to develop adequate data to decide whether it is safe for the drug to proceed with human trials or not, right? And the laboratory tests which are carried out in the series of preclinical trials, right, they are usually done on animal subjects. As I told you earlier, that firstly we study on rodents, and then we proceed the studies on larger animals, and you have to see whether the drug is actually working or not, and whether it's safe or not. Another major objective of the preclinical trial is to submit the file of IND or investigational new drug to FDA. So FDA cannot consider a drug until its IND file is submitted. An IND file, that is investigational new drug, is only submitted after successful preclinical trials. Right? So preclinical trials have the purpose of study of efficacy of drug. It has the purpose to study the toxicity of drug, and it also purpose that preclinical trials are necessary in order to file a drug to FDA. Right? So the drug is filed in the form of IND, that's the investigational new drug, and if the FDA approves, then the drug becomes the investigational new drugs, and it enters into clinical trials. And after a drug enters into clinical trial, and after a drug successfully completes all clinical trials, it is given the status of new drug application, and the FDA then further checks and then approves the drug as a medicine and allows it to be marketed and available in the pharmacies. check that if a drug has a certain biological activity or not. The second step is that we check the drug on isolated organs or bacterial culture. So instead of checking the drug on the whole organism, we check the drug and its effect on isolated organs. Then we test the drug on animal models of human studies, means the animals which have same physiological functions or which resemble with humans, right? Then we make some general observation tests, we make confirmatory tests and analogous activities. Then we study the mechanism of action of the drug, and we study the systematic pharmacology and quantitative tests. So basically the systemic pharmacology and the quantitative tests are almost the science, and then we have the toxicity test. And so these are the tests which are carried out during preclinical trials. Right? So preclinical trials are normally carried out in two steps. The first is the in vitro studies, and the second is in vivo studies. The in vitro studies make use of different cell lines and tissue preparation. So what we take is that we isolate an organ and use its cells or tissues, and we test the drugs on those isolated organs and tissues. So if you are testing a drug outside the animal body, right, then it's called in vitro studies. But in case if you are studying the drug inside human body or inside animal body, that's called in vivo studies. So firstly, we will check the drug on isolated organs, and after successful in vitro studies, we will go for in vivo studies, in which we will actually give the drug to a living animal and observe the changes in the animal behavior. Right? So preclinical trials are carried out in two steps, that is the in vivo studies and the in vitro studies. Right? The screening test is rapidly performed test to indicate whether a particular biological activity is actually present or not. For example, if a drug is being tested for analgesic or hypoglycemic activity, then we will check whether it is actually carrying out that activity or not. Second step is that we will check the activity on isolated organs. Right? For example, we may check antihistaminic activity or vasodilator activity or antibacterial activity. So when we are carrying out these activities, then we are not using animals, but we are using isolated organs. But since these tests are carried out outside the animal body, so these tests are called the in vitro studies. Right? The screening test is also in vitro study, and the test on isolated organs or bacterial culture is also an example of the in vitro studies. Then after successful studies on in vitro studies, then we carry out tests on animal models. Right? So for example, we may check for the human diseases, and in some animal models we can check the effect of a drug to reduce the sugar level in mice. Right? So we are testing the drug for a human disease on an animal model. For example, we may check for seizures in genetically hypersensitive mice. Right? We can check for tuberculosis in animals, and what's the effect of tuberculosis drugs, anti-tuberculosis drugs on mice models. Then we make some general observation. The drug is injected in tripling doses. Right? We get 3 doses at regular interval. Right? So these triple doses which are given, they are then checked for hidden effects. Maybe that when you check a drug on certain animal, maybe you get initially some positive response, but after some time the drug may have some side effects. So we have to check for the hidden effects. So that's why the drug is injected at regular interval in triple doses. So you have to give 3 doses to the animal and check for the hidden effects. Right? And then we draw some preliminary cues whether the drug is efficient or not, and whether the drug is toxic or not. Then we have the confirmatory test and the analogous activity. Right? So we have to confirm whether the activity that was initially observed is also actually present or not, and also we want to study some related activities. For example, if a drug is being tested as analgesic activity, we will also study whether it is antipyretic or anti-inflammatory or not. Right? So we have to confirm the test, and then we have to check for related activity or not. Then in the sixth step, we study the mechanism of action. That what is the receptor, what's the target of the drug, where actually it is binding. Right? So what's the mechanism of action? So whether antihypertensive drug is alpha blocker, beta blocker, ACE inhibitor, or calcium channel blocker, so we have to study the mechanism of action, which is the sixth step. Then we have this systemic pharmacology, right? So if a drug has primary effect, such as analgesic effect, then it is still very important that we check its effect on major organs, right? So whatever be the primary effect, but still we have to check the effect of drug on major organs such as nervous system, cardiovascular system, respiratory system, renal functions, because the drugs don't effect on only one site. They have multiple receptors to bind with. So it's very important that in addition to the primary function of the drug, that it is very important that we check whether the drug is having some effect on other major organs or not. Then we have quantitative test. So in this test we check the dose-response relationship, that how much a dose should be given to have minimum toxic effect and maximum positive effect, right? So we have to check the maximum effect, at what dose gives the maximum biological activity, and what is comparative efficacy, right? So with the expected drug test, if there is a drug that is resembling our drug candidate, that how much dose we are giving of that drug and how much dose we should give for our drug, right? So we have to compare, because if already existing drug has a dose and our dose of the drug which we are considering has to be increased, it means our drug is not active at all, right? So we must have to study the dose-response relationship, that is how much dose must be given in order to get the maximum response with minimum concentration, and at what concentration the drug becomes toxic. Then we have toxicity test, and we have to study the acute toxicity. So when we are in acute toxicity, what we do is that we give a single dose, but that dose should be high, right? So we give high concentration of our drug to a small group of animals, and we check for the hidden effects for 3 days, and we check what is the percentage of animals which are being killed in 1 to 3 days, right? This is called acute toxicity. So the drug which kills 50% of animals, the dose which kills 50% of the animals, this dose is known as lethal dose 50 or LD50. We also studied the organ toxicity, that after 3 days, if some animal don't die, they are not killed, then we'll see the effect of toxicity on certain organs and check whether the drug is being toxic on organs or not. Right, all of these tests which we have studied so far, they should be carried out under standardized procedure of good laboratory practice, or GLP, right? Whenever we are considering preclinical trials, whenever you are considering non-clinical trials, it's very important to follow GLP, good laboratory practice, right? So GLP is useful for assessment of safety and efficacy of chemicals, whether they are normal chemicals or pharmaceutical chemicals, right? Especially when you are studying animals, human, or the environment. So whenever your studies are concerning environment, animals, or man, it's very important and it's very necessary to follow the GLP, right? So what's the purpose of GLP? The purpose of GLP is to ensure the uniformity, consistency, reliability, reproducibility, quality, and integrity of the chemical, including the medicines, in non-clinical safety trials, right? So it means that the chemicals you are using, whether the chemical is a normal chemical which we use in organic synthesis sector, or the pharmaceuticals, that is the medicines which are we using, that means that those chemicals, whether they are pharmaceuticals or not, they must have consistency, they must have uniform concentration or composition, they must have reliable data, and their effect should be reproducible, and they should have consistent results, right? It should not be the case that a drug is giving some positive results in one study and in the other study it has been shown that it's highly toxic. So it's very important for us to, whenever we are considering for preclinical trials or the non-clinical trials, that we must follow the GLP. So before human trials can begin, application of new investigational drugs must be submitted for FDA, right? So as I mentioned earlier, that when you are filing an application for IND, it's very important for you to have completed the preclinical trials, right? So this IND document must include all information on possible risk based on the results of your pharmacological and toxicological data that has been collected during your studies on animals. Now we have just a summary of the preclinical trials, right? The main objective of the preclinical trial is to ensure that the newly drugged molecule is safe to use. Right? It is safe to use on animals, so it should be considered for testing on humans. So the newly developed molecule is never permitted to be tested on human body unless it is quoted for confirmed data on animal studies. Right? So the preclinical trials involve the mechanism of action. It involves study of pharmacokinetics, pharmacodynamics of the molecule, but most important is the toxicological data. So it's very important to have an idea that which dose of the drug gives toxicity effect. Right? So if a drug has toxicity at lower concentration, it means your drug is highly toxic and should not be further proceeded for clinical trials. Right? So very important for you to have the toxicological data in the preclinical trials. Right? So it's very important because it gives a rough estimate about the adverse effects which may likely be seen when the drug is marketed or available to general public. So that's all about the preclinical trials. I hope you have understood this lecture well. Thank you.